Thank you very much, Mr. Satyanarayana ji, Vice Chairman, Virinchi Organization. Welcome Dr. Nirmal Joshi, a very leading physician, very well-known physician in the United States of America and India both, because he was the first director of the big Max Group in India. So he's done a really amazing work in USA, still doing, and now he's branching out and explaining people and making films which are going to benefit the mankind. And I welcome Dr. Sai Ravi Shankar ji, who is a top cardiologist of the city. So with the permission of all of you, I may go ahead. What we are doing is, Dr. Nirmal Joshi is making a film on the prevalence of heart disease in Indians. You may not be knowing that Indians have one of the largest incidence, highest incidence of heart disease in the world. It's very, very common. You must have seen so many news. This person was doing treadmill, young man, and died. This person was running and died. This person was going to the gym and died. So this is all happening because there's a very high incidence of heart disease in India. Dr. Nirmal Joshi has taken this great step of trying to go into this problem, and is speaking to the top doctors all over the world and sharing, getting their ideas, getting their knowledge, and trying to understand why this is all happening, and trying to find ways and means how we can win over it, so that we can give a better quality of life to Indians living not only in India but all over the world. It's a great step, and it's a very, very important step. We have to be all very, very happy with this pioneering work that Dr. Nirmal Joshi is doing. As far as my work, I'm happy that he has chosen to talk to me and share my views. So we have discussed and shared my views with him for the film. So what I'm basically doing is, as we all know, in India, we are not a very super rich country, although our economy is all the time improving thanks to our Prime Minister. So we basically, in India, whether it is a patient or an insurance company or an organization, we can pay for our treatment like a bypass surgery only once. We don't have so much money to keep going again and again. So we have to have a treatment which is going to last us the lifetime. Suppose we have a patient who needs a bypass surgery, he should get a treatment which is going to last throughout his life. And that treatment is what I call Bima bypass surgery. Bima means B-I-M-A. This is a method of bypass surgery which is not being followed very commonly, and we are doing it routinely in Hyderabad in almost all our patients who want to go ahead with Bima. So in Bima bypass surgery, why it is so good? It is good because in 90% patients, even after 20 years, this bypass surgery is working. Why is it like that? Because Bima, that is arteries, spare arteries running inside the chest, are resistant to the aging process of atherosclerosis. So if they are used in a bypass surgery, they just work forever. The leg veins, on the other hand, they work for an average 10 years, as Mr. Satyanarayana has just said. So my request to all Indians is, settle in Hyderabad or outside, if you are advised a bypass surgery, please do not be scared. First of all, bypass surgery in today's date is a very simple and straightforward operation with less than 1% risk to life. And secondly, one should always go ahead with a Bima bypass surgery because it will give long life to the patient. Also, we do the surgery without open heart surgery. Almost 100% Bima bypass surgeries we are doing without open heart surgery, which basically means we don't cut the heart, we don't stop the heart, and we don't use the artificial heart-lung machine. We do the surgery on the beating heart, and with that we are able to exclude all the important risk factors like stroke, kidney damage, liver damage, all these issues. So it's an interesting, important day here, and I once again welcome Dr. Nirmal Joshi, and thank you all for your patient listening.
Thank you so much, Dr. Bhatnagar, for that kind introduction, and thank you very much to Virinchi Hospitals, Satyanarayana ji and Dr. Ravi Shankar, for allowing me the opportunity to not only film in this absolutely beautiful location. This is a wonderful hospital. My first visit to Hyderabad in a very long time. I think the last time I was in Hyderabad was 35 years ago. So what a beautiful place this is, and how much progress hospital systems have done is really pretty typified by Virinchi Hospital here. So thank you very much for having me. It's very kind. Like the group said, one of the first things that I've been struck as I've been thinking about, as I've been traveling across the country, I've been in Delhi, Lucknow, Bangalore, Hyderabad, then heading to Chennai, Pune and Mumbai, is that how much progress our country has done in cardiac care, actually in healthcare overall, but in cardiac care in particular. One thing I say publicly whenever I get the chance is that India has unequivocally some of the best doctors in the world, some of the absolute best doctors in the world. Whether they stay in the country, like Dr. Bhatnagar, or they've left the country and practicing anywhere in the world, whether it be in the UK, the USA, or anywhere, Australia, what have you, we make a name for ourselves like almost no one does, and I think we are very, very proud of that. Now, in terms of the documentary, it's called The Brown Heart. The reason I chose to make this was, I've done about 35, 40 years of healthcare. I've taken care of patients, I've taken care of people. When I take care of a person, I impact that life, that one life. Similarly, when Dr. Bhatnagar takes care of a person, he impacts that one life, right? Very important life, but one life at a time. And I thought there was a time in our lives when, or in my life for sure, that we needed to do something bigger. We needed to do something where millions of lives could be impacted simultaneously, which is what led us to conceptualizing the concept of the brown heart. The reason we call this the brown heart is that the Indian heart is unique, right? As they say, हमारा दिल थोड़ा नाजुक है, थोड़ा कमजोर है, right? It's slightly different. And the reason it's different is that it is well known now that a lot of us suffer from heart attacks very, very early in life. And many of us die from heart attack very early in life. That's a shame. It should not be happening in today's day and age, this many of us. 50% of heart attacks, half of heart attacks across the world in Indians occur in people less than 50 years of age. Can you imagine that? 50% heart attacks, I'll repeat, in Indians occur in less than 50 years of age. You probably heard last year there were a whole slew of deaths in Garba that were reported, in people who were 19 years old, in people who were 25, 30 years old, sudden deaths from heart attacks. Dr. Bhatnagar was sharing with me earlier, the youngest patient he's operated on for a bypass graft surgery is only 19 years old. Think about that. Someone who's 19 years old getting a heart attack, right? That has to stop. That's why we're in the process of creating the brown heart. Too often, we just go out and educate people. We talk to people. We say, hey, you should eat better. You should exercise better. You should do this. You should do that. But no one's listening to us, right? No one's really listening to us. So we thought we needed something on a much bigger scale, on a scale that looks like a real film. We all love films, right? So to do this in a scale that looks like a real film. And so we got funding from charity sources about 4 months ago, and we began to create an entire film around this so important topic. So between my wife and I, we have now traveled to different parts of the United States, to the different parts of the UK, to Birmingham, to Edinburgh, Scotland. We've gone everywhere to talk to people like Dr. Bhatnagar, to talk to experts across the globe, and to also capture human stories. What happened to people when their loved one got a heart attack? What did they do or not do in their lives to get a heart attack, right? It is so important, and then we are putting it together in the form of a beautiful story that I hope will be very, very engaging, will be something that people will be able to look at and say, wow, I did not know that. And perhaps the most important part of this, which will be mission accomplished if we are able to do this, is that the last third of the film, 1/3 of the film, is focused on what can you do about this problem, right? And this is not just talking down to people saying, "Aapko exercise karni hai, aapko diet better khani hai." Everyone says, "Yeah, the whole world tells me that, but how do I actually do it? I can't regularly exercise. I have pressures of life. I can't eat healthy for a variety of reasons. I'm traveling, I'm doing this, I'm doing that." So we distill it down to say, here's how you start, right? When you make a change in habit, start real small. We've talked to habit experts, we've talked to other people. So we dumb it down to being able to take it back to the audience, to be able to say, hey, if only I could start with 1 or 2 things that will change my life, these are the 1 or 2 things that they ought to be, right? So that's the goal of the film. I'm delighted. I can't tell you the warmth and hospitality extended by you folks is second to none. I've been absolutely humbled and blown away by the love and care that you folks have shown. Dr. Bhatnagar is a long-time friend. He's a schoolmate of mine from 40 years ago, okay? And he was just as brilliant then and just as brilliant now, except he's done a whole lot of beautiful things between then and now with his hands. And I'm delighted and proud of him as someone who I care for and deeply respect. And I'm glad that the hospital here has recognized his phenomenal talent. And I'll end by saying that in the context of heart surgery, or any surgery for that matter, the more a surgeon does, the better he or she gets, right? And Dr. Bhatnagar has narrowed down to this particular type of surgery called the prima grafting, which he has absolutely mastered. We were just talking about the fact that how many of these surgeries he has done. At one point he would do 6 to 7 of these in one day. Sometimes in the US, that is the number done in an entire year with this kind of surgery, right? And he's doing a handful of them every single day. So delighted that we are here, and thank you all for being here and being able to hear about this. We are planning a release for the film sometime in June, or at least completion, I should say, of the film sometime in June. We're talking to at least 2 or 3 streaming platforms, and I'm very optimistic that it will find its way into a streaming platform. This has never been done like this ever in India for sure. Thinking of a docudrama, taking a topic that is critically important and putting it out in a way that people can understand, people can enjoy, and people can take home something that they can change their lives. Thank you very much for having me.
Gentlemen, you have heard Dr. Nirmal Joshi in so many nice terms. There's nothing like storytelling. The art of storytelling is very, very important, because we only relate to stories, and those stories should really pertain to fellow humans who have undergone such kind of difficulties and who have survived. And also we need to understand from the care attendants of those who couldn't make the cut as well, unfortunately, so that learning is very, very relevant, and contextually it can offer us a perspective. Having said that, I would welcome the audience, the consultants and press to pose any questions to either Dr. Nirmal Joshi or to Dr. Prateek Bhatnagar in terms of further explaining about the procedure or the mission they are embarked upon. Over to you. Any questions?
Mike.
Dr. Atiku?
Mike.
हेलो डॉक्टर जोशी, श्रद्धा हियर फ्रॉम हिंदी मिलान। आपसे क्वेश्चन है, ये सुनने में आया है कि जब से कोविड वैक्सीन्स ली हैं तब से हार्ट प्रॉब्लम्स बढ़ी हैं, ये कितना सच है?
So the question was, जब से कोविड वैक्सीन्स आई हैं तो हार्ट की प्रॉब्लम्स बढ़ी हैं। तो yes and no. Yes in the sense कि there is a very small number of people who have developed, जिनको हार्ट की माइनर प्रॉब्लम्स हुई थी फ्रॉम कोविड वैक्सीन्स, राइट। हाउएवर, जब भी किसी चीज़ को आप देखते हैं तो दो चीज़ें देखते हैं। एक तो हम जो डिनोमिनेटर कहते हैं, न्यूमरेटर कहते हैं, राइट। डिनोमिनेटर मतलब कितने लोगों को लगी कोविड वैक्सीन, और न्यूमरेटर मतलब कितने लोगों को उससे परेशानी हुई या कोई साइड इफेक्ट हुआ या जो भी हुआ। सो द नंबर ऑफ दिस प्रोपोर्शन इज एक्सट्रीमली स्मॉल स्टिल। एक कॉमन मिसकंसेप्शन है इंडिया में भी और बाहर भी, दोनों जगह एक कॉमन मिसकंसेप्शन है कि समहाउ ये जो हम कार्डियक डेथ्स देख रहे हैं या ये सब देख रहे हैं ज़्यादा, जैसे गरबा की डेथ्स हुई थी या कुछ और हुआ था, ये कॉमन मिसकंसेप्शन है कि ये कोविड की ही वजह से हुआ था। ऐसा नहीं है ना, छोटा सा उसका कंट्रीब्यूशन रहा होगा, आई एम नॉट डिनाइंग दैट, लेकिन हमारी जो प्रॉब्लम्स हैं जिनकी वजह से हार्ट अटैक्स हो रहे हैं, दैट हैज बीन देयर वेल बिफोर कोविड, पिछले 10 साल 15 साल 20 साल से, जो कि अब बढ़ा है पिछले 15-20 साल से। लेकिन द इंसिडेंस ऑफ हार्ट डिजीज इंडियंस में, खास तौर से इंडियंस, पाकिस्तानी, बांग्लादेशी या नेपालीज में करीब 2 से 4 गुना है दुनिया की किसी और भी रेस से कंपैरिजन में। तो इन शॉर्ट छोटा सा कंट्रीब्यूशन रहा होगा, लेकिन द मेजॉरिटी ऑफ कंट्रीब्यूशन अब ये नहीं कह सकते कि कोविड की वजह से हुआ है। मोस्टली हमारा जो जिस तरह से हम लोगों ने अपनी लाइफस्टाइल करी हुई है, चाहे वो फूड हो, चाहे वो एक्सरसाइज हो, चाहे वो स्ट्रेस हो, ये सारी चीज़ें जो है हम एक एक करके फिल्म में इसके अंदर घुसते हैं और बताते हैं। कोविड का कंट्रीब्यूशन, अगर हम कोविड कहते हैं तो एक तरह से इसके टेंडेंसी होगी, यार वो तो कोविड की वजह से हो गया था। दैट इज नॉट ट्रू। थैंक यू। एनी अदर क्वेश्चंस?